Friends, I am Dr. Ghosh. Welcome to my channel, Dr. Ghosh Presents. Homeopathic remedies for gastric problems. What is gaster or stomach? Alternative name. Gaster means stomach. What are its parts and functions? Stomach is a reverse C-like hollow muscular organ which acts as a primary receptacle of foods, drinks and different secretion from mouth, esophagus and stomach itself. It has got three parts: fundus, body, pylorus, and two openings: esophageal opening, sometimes it is also called cardiac sphincter level. I mean, it's cardiac sphincter. That sphincter means actually what happens, this is here. Here there is a sphincter means valve-like action. There are two sphincters, pyloric sphincter and cardiac sphincter. This two sphincter actually controls the incoming and outgoing of food and other contents. The two openings are mainly pyloric and esophageal. Esophageal and cardiac, same thing, opening. Functions: receives contents from esophagus and stores temporarily. HCl secretion and antibacterial action. Preliminary digestion, control discharge of contents into duodenum. That is, control how this will go to duodenum, that is small intestine, starting part of the small intestine duodenum. This control of moving the food is also maintained by this stomach. What are different causes of gastric problems? First, GERD or gastroesophageal reflux disease. This is the picture of GERD. The acid content is refluxed from stomach up to throat region. This is called gastroesophageal. Mainly heartburn in the symptoms. Heartburn, discomfort around the throat, behind the heart, there is heartburn. This is the main symptoms. Gastritis. Gastritis is generalized inflammation of the mucosa or inner lining of the stomach. Generalized it is gastritis. Gastroenteritis, the same thing. The gastritis is there. Along with this, in the enteron, that is intestinal walls are also inflamed. These are called gastroenteritis. Peptic ulcer. When there is deep-seated ulcer, localized deep-seated ulcer in the inner wall of the stomach, this is called peptic ulcer. Gastroparesis. Gastroparesis actually when the stomach fails to empty its content into the duodenum. See, this is normal. This is normal action of stomach. The stomach content is going out. First stomach content, stomach gets the content, then it is opens up and it is gradually going down. Sometimes what happens, the stomach cannot contract. Paresis means actually paralysis of the stomach. Muscles are not acting. Maybe nerve problem, maybe muscle problem. Actually, paresis causes a main cause of vagus nerve disturbance due to diabetes or surgery, viral infection, narcotic drugs, antidepressant drugs. These things cause this paresis or paralysis of the stomach. Non-ulcer dyspepsia. That is dyspepsia, functional dyspepsia. Functional dyspepsia means there is no organic change, just functional. Acid secretion is troublesome, or some this is partly the stomach is not acting as it should have acted, and ultimately stomach cancer is another very common cause of gastric problems. What are signs symptoms of gastric problems? Pain and discomfort in throat, stomach area, heartburn, feeling of fullness, easy satiety, loss of appetite, nausea, vomiting, bloating, weight loss, excessive fatigue, blood vomiting, tarry stool. Generally, in case of serious problem like peptic ulcer, cancer, this type of symptom usually comes: tarry stool, blood vomiting, excessive fatigue, and weight loss. Particularly in case of cancer, there will be no response to any medicine Whenever given to control nausea or vomiting or bloating, there will be no response. If it is cancer, there will be no response. And in case of cancer, there will be excessive loss of body weight. These are the common symptoms of gastric problems. And heartburn. This is heartburn. It is called heartburn because it is felt just beside the heart, but it can be felt also in the throat region or also in the stomach region itself. Titanium met for gastric problems. Chronic cases, excessively severe distress and pain, which relieved only by vomiting, great emaciation and weakness. Mind this symptom. Great emaciation and weakness, these are precursor symptoms of gastric carcinoma or cancer. During pain, constant eructation of fetid gas from stomach with constipation. Bowels much distended. Arsenic album from gastric problems. Subacute gastritis. Periodical burning pain, least food or drink vomited out as soon as taken. Dry mouth, burning thirst. Restless, moving around despite pain, extreme tenderness in the pit of stomach. Mind this extreme, restlessness, burning thirst, dry mouth. These are characteristic symptoms of arsenic. It is present in all arsenic cases. And the pit of stomach, I will describe it later. Lamentation with agonizing expression, despairing of life. Despairing of life is a characteristic symptom of arsenic. Tongue whitewashed or red with raised papilla. Distressing heartburn with slimy, bloody diarrhea with violent tenesmus and burning in rectum. Also, burning is a characteristic symptom of arsenic. Face hypocritic, extremities cool. Ischulus hypocystinum. Ischulus hip, in short, for gastric problem. Subacute gastritis. Unbearable burning, aching, distress in stomach. Retching, violent vomiting. Extreme weakness and faintness. Breathrum album from gastric problems. Hematemesis with slow pulse, cold extremities and sweat. Fainting fits, nausea when rising and moving. Anguish at the pit of stomach. I will describe all this thing just at the end, towards the end, at the pit of stomach. What is pit of stomach? What is anguish meant at the pit of stomach? And sometime it is epigastrium, sometime various places, precordium. I will explain everything. Pain radiating upwards and to both sides, reaching back between lowest point of scapulae. Becomes agonizing and then subsides. Violent vomiting with constant nausea and great prostration. Hypocritic face, icy coldness of extremities. CPA for gastric problem. Pit of the stomach, too sensitive. Abdomen bloated. Headache with congestion and heat. Tongue coated, often sore and covered with little blisters on edges of tip. Small, sour smell in mouth. Urine too smell sour. Urine too smells sour. Clear like water. Takes cold when weather changes. Antimonium tartaricum from gastric problem. Persistent nausea, vomiting with oppression and tightness in the epigastrium. Violent spasmodic vomiting following exhaustions and drowsiness. Vomiting of pus tinged with blood. Loathing of food. Face sunken pale. Precordial anxiety after eating. Unpleasant sensation of heat and burning in gastric region. Now one by one, pit of the stomach. What is the pit of the stomach? The pit of the stomach, actually, this particular area. This is the xiphoid process of sternum bone. This is xiphoid process. Note, this is xiphoid process of sternum bone. Just at the end of the xiphoid process, there is a pit. It is called pit of the stomach. And epigastrium is the whole region. See, this the epigastrium, whole abdomen is divided into 9 parts. The central part of the upper region, the central part, that is this portion, central part of the upper region is called epigastrium. There are 9 regions, it will be discussed later on, and the area of the anterior wall in contact with heart is called precordium. That is Adjective precordial. Argentum neat for gastric problems. Incessant vomiting of food with a smooth tongue devoid of papillae. Note the image here. This is normal tongue. If you carefully look over the surface of the tongue, you will see the raised, small raised pinhead-like structures called papilla or papillae in plural are seen. Note this tongue. This is polished tongue. This is varnished tongue. No papillae is there. This is the characteristic symptom of argentum nitricum tongue. Small spot between xiphoid process and navel becomes sensitive to pressure, wherefrom pain radiates in all directions. Xiphoid process I have already described previously. Navel you know. So in between that there is a point wherefrom pain radiates to in all directions. Pain in stomach after eating. Endoscopy shows perforating ulcer in stomach. That is, argentum nitricum is a very good medicine for peptic ulcer. Patient think time passes slowly. Impulsive and hurried. Great craving for sweets. This is characteristic of the person, not of the disease. The person, and when the person's the symptom of the person matches, that symptom becomes very much appropriate for the particular patient. These are called general symptoms. Bismuth met for gastric problems. In some book it is also mentioned as bismuth only. Inexpressible pain in stomach after surgical operation. Flatulency, white tongue, stool, cadaverous smelling. Patients eat for several days, then vomit. Feel better from cold drinks. Vomiting occurs when stomach becomes full. This is the reason why the patient eats for several days, then vomits. Patient cannot stay alone, wants company always. This is also general symptom. This is not related to patient. This is related to the patient, not to the disease. And the symptoms who relate to the patient is much more important for individualization of the patient. That is most important in homeopathy. Cuprum met for gastric problems. Nausea and eructation with painful and long continued hiccup. Rumbling in abdomen. Sensation of a ball going to and from, to and fro under the ribs. Worse from liquid food, vomiting of bile, better feeling from tight clothing, from lying quiet. Extremities cold. Iris versicolor for gastric problems. Colic pain every few minutes in epigastrium. I will show which area is epigastrium very soon. Shocks of pain from umbilicus to epigastrium. Vomiting, diarrhea accompanied with burning with anus and great prostration. Burning in mouth, fauces and esophagus. Sick headache with blur before eyes. Now look at this images here. This is the abdomen. The abdomen is divided in clinical medicine 9 parts. This part is called right hypochondrium, left hypochondrium. This is epigastrium, just beneath the pit of the stomach. This area is called epigastrium. This is umbilical or umbilicus. Left lumbar, right lumbar, right iliac, left iliac, hypogastric region. These 9 regions of the abdomen is used in clinical medicine.